Is it better to manage this condition with medicine, such as topicals, creams, ointments, solutions, or should I manage this with medications that I take orally, or should we just go straight for the surgery with lasers or traditional surgeries? And the correct answer for this is you actually need a combination of all of the above, in the sense that for milder diseases, you can probably get away with things like laser hair removal, probably even a few topicals, but for more moderate condition levels, you might need something more strong, such as antibiotics, such as other types of immunosuppression, like biologics, for instance. Some of them are injectables, and soon we'll be having a couple orals that will be available. And ultimately, surgery is the most definitive treatment for this condition. So I tend to reserve surgery for patients who are very well controlled in a combination of topicals and orals, and sometimes even injectable biologics. But you cannot just go straight to surgery without having adequate control, if that answers the question. And so overall, this is a condition where we know it starts from the hair follicle, whether it's the lining of the hair follicles that do something to trigger the immune system, we don't know. Whether it's the bacteria or the fungi that inhabit the follicles that trigger it, we're not sure. But we know that the downstream implications lead to chronic scarring, sinus tract formation, tons of discharge and pain. And number two, it is not a contagious disease. It is something that needs to be well managed, but certainly not something that you have to worry about when going into a public condition, especially if it's well managed and you're not draining, etc., etc. And then finally, the condition is best managed with surgery. I think is best managed in patients who are very well controlled with topicals, with orals, with injectables. There are various combinations and every patient is different, but certainly I recommend treating this condition surgically and just getting rid of it once and for all. So I hope I answered your top 3 questions. Looking forward to hearing your comments below.